Great, thank you, Sakti. And the only thing I'll disagree about is I really have two talks. And because this meeting is about a consortium of universities, I want to talk a little bit about how we're doing it as, I won't call it a role model, just one possible solution for how to get engineers engaged in this whole global health thing. I mean, there really is a gap, okay? And what I've discovered is the commonality between engineers and doctors is they're both faced with sort of a critical problem, how to fix something, okay? And they're both really compatible when you say, what is the thing to fix? So my job is to try to sort of bridge that gap a little bit. Can we bring the lights down just a hair? Because I've got some pictures on it. Let's see if this works. Pushing it on the, okay, good, it does work. Briefly, I'm going to go through several things here, probably too many, but I'll talk briefly about bioengineering, and then talk just at the end about some of my projects, two of them in particular, but it'll be kind of light on the technology and heavy on the what are we doing with all this. So again, lights, does anybody, can't go bring the lights down at all? This is it?
It's really dark, but take it down to the next level. I mean, I can give it a shot if you want.
Try it, let's see what happens. If they start snoring, you went down too far, right? So there really are lots of connections between biomedical engineering or bioengineering departments. We use those names interchangeably. We're a bioengineering, it doesn't really matter. I may call them BME departments. There are lots of national resources which are pretty exciting. One of these that's been around for a while is Engineers Without Borders. They have a pretty powerful, they cover a wide range of things. There's a very active chapter here. They do things like they go to a village and they change the cook stoves, they build roads, they do all sorts of really incredible active things. But they're not specifically biomedically oriented. Engineering World Health, which is sort of Duke-centric but with a national presence, is doing some very interesting biomedical things. They have a fabulous program of getting engaged in bringing engineers to repair and work on equipment in the developing world. There's loads of schools out there with engineering programs with good connections to global health. The ones that I've seen that have been the strongest so far have been Duke and Rice. And I went to Rice at a pivotal moment in my career and said, wow, these guys really do it right. And everything we're doing here at UW in many ways is slavishly imitating what I've seen Rebecca Richards-Gordon and Maria Oden do down there. Berkeley's also got this Berkeley Alliance for Global Health, and then I would say, kind of like Microsoft, you sit back and let the little companies do it and then you just buy the company. We're sort of in that position. I don't know, maybe it's a local problem. Okay, yeah, like I said, the technology is fun. So briefly, let me tell you about UW. First of all, what is bioengineering? I usually think of it as this space between medicine, physiology, physical sciences, engineering, and it's in the middle. It's not any one of those things. It's sort of the interface between them. And I'll point out that we're in this building. This is the drawing, but it's been open now for 4 years. When it was in the planning stages, and we were informed that the naming rights for the Gates Foundation, which put $90 million into this joint building between bioengineering and genome sciences, most of us said William H. Who, and we couldn't pronounce it. And now we understand who that person is, and we're delighted to meet him on many occasions. And it's really very exciting to have that. It is also a big burden because it means that all of a sudden we're all sitting in a building where we're probably expected to do the next major cure of a major disease. We're about 484 people total. It's a lot of folks. It's a very interesting organization, and like I said, one of my hats is being responsible for this horde of people. There we go. What's really exciting about doing that here, if you're interested in global health, is that we're sort of sitting at the nexus of a whole bunch of resources here. PATH, you've heard about a bit already. The head of the Diagnostics group is a guy who did a postdoc in my lab. The Global Health Department is something that we're really actively trying to work with. Judy and King and I spend several phone calls already talking about a possible joint hire. Hint, hint, if anybody's interested, talk to me. Obviously, the Gates Foundation being down the street doesn't hurt. It didn't hurt in a lot of ways, and there's been a lot of chatter back and forth between these two organizations. IHME is really exciting. Chris Murray, I think, is really the key guy, or at least his ilk of person, because they're going to be the ones who tell the engineers don't bother making a diagnostic or a therapeutic for that, because it's not going to make a difference in that community. This is what's going to make a difference. And the biggest problem we have in the engineering community is, well, I know how to make one of those, and you send your students in the lab and you make one of those. Whereas what you really want to do, as everybody in the medical field knows, is find out what the actual medical problem is and work the other direction. So Chris has really got a capability for doing that on a large scale, and I think that's important, not just in the developing world, but even here in the US. I don't think we work that way enough. And then finally, Seattle, what's now Seattle Biomed, SBRI, another major organization in town that we also collaborate with. So what do we do? Well, we have, for our undergraduates, we have this thing we call a capstone project. All of our undergrads, it turns out, have to work in research labs. This was a sort of innovation we brought into the program where we really geared up our undergrad program about 10 years ago. And we said, okay, everybody's got to be doing research. So every undergrad has to do that. Historically, most of the students spend more than 2 years in one lab, some of them 3, some of them 4 years. The work has been mainly research, but they have to have a required design element. That's how we got our ABET accreditation. To be an accredited engineering undergrad program, you have to go through ABET, and there needed to be design. Many of these students actually publish papers on their work, and in fact we found that they're in many ways more effective than the graduate students because they're on a tight schedule, they work hard, and they want to go to med school or grad school, most of them, and they want to get those recommendations. We have a new capstone design program that we're putting together now, however, which is actually more based on really the successes at Rice, which is a team design project. We call it a conventional engineering team design program, where you have a group of people, 4 or 5 students working together on a common project. They're going to be derived from a variety of things, one of which is consulting with global health faculty to find useful projects that would actually work. And we want to actually work with the MDs who are going to those countries in the field as part of the global health program itself to make sure they're really relevant and get as many of the students there as possible. So Bioengineers Without Borders is an entity that was actually created. We heard earlier today there's a lot of pressure bubbling up in the undergraduate ranks at a lot of universities. It was really true at our department, and we were sort of cautiously working with global health to set things up. And of course, the undergraduate students don't want to wait, and they said, look, we're going to create this organization last year called Bioengineers Without Borders, a local thing. Mostly bioengineers, there's some physics in other departments, but almost entirely bioengineers. We put some money into it and said, okay, we'll support projects you want to do, see what you can do, contribute to competitions. The mission they have is to develop technologies to reduce disparities in global health. Current endeavors, they're developing mobile healthcare diagnostic instruments for developing world environments. They won a student design competition at the National Academy of Engineering Grand Challenges Summit here in 2010. They're interested in testing these things in developing world hospitals, and they're engaging in a lot of outreach to educate visitors and other people about health disparities. So these people are actually doing global health outreach activities while undergraduates in an engineering department, which we think is kind of fun. Just as an example, one of the ideas was to put together a 12-lead ECG or EKG from a chip that they designed, which would then work through a cell phone or a PDA as the output device. And they've actually built the design, actually tested a functional prototype of these things. They've also worked on a bilirubinometer, a really low-cost bilirubinometer to avoid blood draws in the developing world. Again, these are early-stage projects, but they've got the board circuitry, they've designed it, they've built it, and they've tested these things. And again, the emphasis is this wasn't even an educational program. This is the students doing it entirely by themselves. We have one faculty member, Dan Ratner, who's acted as sort of the entrepreneur who oversees all this, but it's really been student developed, and it's been really exciting, and they're making lots of connections themselves. So this is the sort of thing you will find engineers ready and willing to do at any university, I promise you, certainly that has a biomedical engineering department in it. Briefly, graduate education, we have a pretty strong graduate program. There are several faculty members on the list here who are tenure track people who've been working on a variety of projects that relate to global health projects. There are actually 3 research faculty members shortly in the department who are also working on point-of-care diagnostics and these things as well. Some of us have collaborated. Many of us are doing work that's related to diagnostics in collaboration with those people I showed you on the list.